Today I have Abdul El-Sayed. He is, if you're a political guy and you're part of the Bernie Sanders movement or a progressive in general, you definitely know who he is. He ran in 2018 for the Democratic primary in Michigan for governor, and he's also a doctor, and we're going to talk about the pandemic, and he was also the former Detroit City health director. So Abdul El-Sayed, thanks so much for coming on the program. We greatly appreciate your time.
Rob, thank you so much for having me. I'm really excited to be with you.
All right, great. So can you just tell the viewers who are not familiar with you why you got into medicine and public service in general?
Yeah, well, look, I'm a son of immigrants. My parents immigrated here from Egypt, and many of my summers growing up, I would travel the 15 hours that it would take to go to Egypt. And on those 15-hour journeys, I'd travel about 10 years difference in life expectancy. And while I was there, I would hang out with my grandparents, aunts and uncles, and my cousins. But in particular, I'd spend most of my time with my grandmother. She never got to go to school despite being the wisest, smartest person I've ever met. And she would constantly remind me the opportunities that I had. She'd point to one cousin and say, that one's smarter than you. Point to another one and say, that one's taller than you. Point to a third and say, that one's better looking than you. And her point to me was that there was nothing special about me. There was something special about the place that I was growing up and the opportunities that I had because I was growing up there. And the crazy thing was that, I didn't have to travel 15 hours to go 10 years life expectancy, right? Egyptian life expectancy is 10 years shorter than ours in the United States. I could drive from my home in the suburbs just outside of Detroit to any neighborhood in Detroit in 25 minutes and travel that same life expectancy gap. And I wanted to do something about that. That's why I went into medicine. And then came to appreciate that so many of the challenges that people face have less to do with our healthcare system, which seems to be more focused on making money off of them, and a lot more to do with the opportunities they have in their lives. And so that's what led me into public health and ultimately into politics.
So can we talk about this? Now, you were the public health director of Detroit from 2015 to 2017. We saw what happened in Flint, Michigan throughout, the past so many odd years, and they still haven't fixed the problem. And now during this crisis, it's insane over there. Well, not, also throughout the country. So what issues did you face as a public health director in Detroit? And also, as far as Flint, Michigan goes, can you give us a little bit of an update of what's going on there still with people still getting poisoned with the water over there?
Yeah. So I walked into a department that had been shut down because of austerity politics in Michigan. They privatized their health department. My job was to rebuild it. When I started, we had 5 city employees and 85 contractors in a city with a higher infant mortality rate than Egypt's, threefold the probability of asthma hospitalization and 4-fold the probability of lead exposure. And they had shut down their health department. We wanted to rebuild it around the well-being of kids, provide every child basic access to the means of a dignified life, whether that meant making sure that they had access to glasses delivered free at school, standing up to some of the biggest polluters in the state that are the reason why our kids breathe polluted water, or making sure that their schools weren't exposing them to lead. And we led on those goals. I was in that role when the Flint water crisis first started, and watched kids who looked a lot like the kids that I was taking care of in Detroit poisoned because of the same austerity politics that had shut down the health department in Detroit. Obviously it's no longer the headlines, but you think about this pandemic and the way that it's impacting folks. One of the first things we told people was that you should, wash your hands with warm soapy water for 20 seconds. Now, that's a lot harder to do when you live in a community where you don't trust the water. And so while the worst of it has passed, a lot of people still don't trust their water, and for good reason. Right? The pipes that caused the problem are still in the ground. And so, you think about how the pandemic complicates that. All of these things tend to flow together, and that's part of the problem.
Abdul El-Sayed here on Fire Breathing Rob. I want to talk a little bit about your election quick before we go into 2020 and a little bit about the stimulus and what's going on right now with the COVID-19, that you're a medical doctor and you know these issues firsthand. Can we talk about how difficult it was to run as a first-time candidate against the Democratic establishment as a progressive candidate?
Yeah, it was really hard, Rob. obviously I'd never run for office before, and I was 32 when I kicked off my campaign. And everybody kind of wrote me off. And we started to build. We started to go out there and talk to folks and talk about our politics and what it is we believe. The fact that healthcare ought to be a right in our country, the richest, most powerful country in the world. That people ought to have the right to organize at their workplaces. That minimum wage hasn't kept up since the 1960s. That it ought to be $15 an hour or higher. That we have stripped away the fundamental dignities that the economy used to offer to poor and working people, and that we, in a state that's defined by its fresh water, ought to be protecting our Great Lakes and fighting for a green, sustainable investment in our infrastructure. The Green New Deal wasn't a thing yet, but that's what we were essentially fighting for. And the establishment didn't see us coming. We were able to raise over $1 million in about 7 months, and then ultimately raised about $5.5 million. But still, right, there were, they sort of hatched a question about my eligibility to run, which really did damage to my fundraising based on the fact that I went to med school in New York and had voted there, and they made a big issue out of this, despite the fact that I was definitely eligible. There were ways that the establishment candidate moved money that had corporations giving to these shell accounts in the Democratic Party that then gave to this 527 that then illegally ran ads for that candidate. And then I had another guy who just basically pilfered my message, but had $10.5 million in his own money to spend on it. So ended up being a really challenging run, but I'm really grateful. We earned endorsements from Senator Sanders and Congresswoman Alexandria Ocasio-Cortez and The Nation magazine, and ended up earning over 340,000 votes to finish second in the primary. I learned a lot, and for me, it's never really been about the what. I don't really care as much about what my job is or what my title is. It's really a lot more about the why, and the why continues. And it's the same work that led me to rebuild a health department in Detroit, that led me to run for office. That's leading the work I do now. I wrote a lot about it in my recent book called Healing Politics. It came out end of March. Hell of a time to publish a book, but it came out at the end of March, and it really, in a lot of ways, speaks to the circumstances we're in right now and what we need to do to get out of them.
Right, I definitely want to get to that book. A few questions on 2020. As a Sanders supporter myself, and I watched you at the rally in Michigan with him, and there was a huge crowd there. But can we talk about this? Why do you feel like the Democratic Party never learns their lesson? They run these corporate, moderate, warmongering candidates, and they lose. We saw what happened with Hillary Clinton. Now Joe Biden. Barack Obama did win, but he won on a big progressive message, and he actually ran a campaign like Senator Sanders did, where he got young people and people from old and young all enthusiastic to run, and he ran as a progressive. So why do you feel like they don't listen to the progressive movement? They seem like they don't learn.
Well, there are a lot of powerful folks who have a lot to gain by protecting the status quo. There's a lot of money to be made off of the insurance industry, a lot of money to be made off of fossil fuels, and a lot of money to be made off of selling weapons abroad. I think our job is to stand up and build and organize and continue to demand that our politics meets this moment and serves the people. And I think we can never stop doing that. I do think, right now, the challenge is that we are where we are, and we have a responsibility to beat Donald Trump. And a lot of folks say, well, there's really not that much of a difference between Trump and the party establishment. I just don't think that's true. And my issue there is that I come from one of those communities that this president has really marginalized and gone after. And I know what the difference between Donald Trump and Barack Obama or Joe Biden would be. And so I want to spend the next 4 years, rather than organizing and fighting against the repeal of the ACA, I want to be fighting for Medicare for all. I want to spend the next 4 years, rather than fighting against the repeal of basic climate change legislation, I want to be fighting for a Green New Deal. Rather than fighting against a border wall, or a Muslim ban. I want to be fighting for real immigration reform. And I think we have that opportunity. And the work continues, right? I was a big supporter of Senator Sanders and would have loved to see him, running right now. But it didn't end up that way, and the work will keep going. So I see our responsibility right now as beating Donald Trump, and then continuing to fight for things like Medicare for all, a Green New Deal, real immigration reform, free college, and real criminal justice reform, investments in public education, and taking the corporate interests out of our politics.
I have two questions from viewers of this program. And so this is from Karen from Virginia. She wanted to ask, what is your opinion on the 2020 Democratic primary?
Yeah, well, look, politics are a really frustrating endeavor, and it didn't end up the way that we wanted. And you point to any of those things and say, oh, that all of those things worked against Bernie, and in many respects they were deeply unfair. But I do think we can't argue with the fact that there was a profound groundswell of support that Joe Biden did pick up, and it was led by African American voters in the South, and and really took hold in Michigan, in a state that Bernie had won in 2016. And so I'm never going to deny those folks their votes. And the question that I continue to ask is, what can we learn? Like, how do we earn the trust and the votes of folks who in our society have really been dealt a bad card, and how do we continue to win them? And I think it didn't go our way in 2020, and my hope is that all of us progressives ask, all right, what does it mean, so that no matter what happens at the very top of the party, no matter what powerful people in the establishment do or say, that the trust and that the endorsement of individual voters on the ground is with us in the future. And that's what I'm committed to building. And that's what I think all of us have to be taking notes on and saying, look, all right, didn't end up our way in 2016, 2020. We will keep coming, because the country needs us, the world needs us, and we know that we have something real to offer here when it comes to rethinking a lot of the systems that have led us into this pandemic, quite frankly.
Abdul El-Sayed here on Fire Breathing Rob. This comes from Terry in Rhode Island, who is also a Sanders supporter. He also just sent this question in the other day, saying, you are part of the healthcare portion of the Bernie Biden task force rather. What do you feel like you want to accomplish in that task force in your position? Obviously, we're all for Medicare for all, but what do you feel like you can push the Biden campaign to get? Yeah.
Well, I've got a book coming out on Medicare for all, co-authored with my friend Michael Johnson in February. And so I believe deeply in this policy, and I believe that that's where we need to go. And if we can't get Medicare for all, my question is, what are the things that we can address that Americans all over the country are suffering from? Whether that's the impossibly high cost of out-of-pocket costs when just to get your health care in the first place, even if you're insured. The fact that 10% of the population isn't insured at all. The fact that prescription drug companies continue to get their way and charge us more than any other country in the world. Whether it's the fact that we don't have a real functioning mental health system or a long-term care system, or even bigger than that, the fact that our public health system has crumbled and left us in a heap on the floor in the face of this COVID-19 pandemic. So all of those things need solutions. I would love to see a much more robust ramping up of Medicare and Medicaid. I would love to see us standing up against some of the corporate takeover of those programs. I'd love to see far more support for young people and children than we have right now. I'd love to see the opportunity for states who want it to be able to pursue Medicare for all with the support of the federal government. Those are things that I'd love to push for. I haven't had those conversations yet, and I think that there's a lot of conversation left to have. But I'm confident that people recognize that this is a unique moment, and unless we're willing to meet this moment where it is, we will be failing the American people. And so we've got to propose solutions at the level of the problems that we have.
I agree. We saw Medicare for all. Every poll in the primary states, even in Mississippi, got over 60%. So if you're getting it in Mississippi, then A lot of people want it all over the country. I want to talk about this. I want to switch gears and go to the stimulus and the COVID-19. As somebody that's a medical doctor and somebody who knows the political system in general, I think you could answer these questions extremely well. With the stimulus bill, we saw that it gave a lot of money to big business and also tax breaks to millionaires. The working people like, you know, me and thousands of people, millions of people, I should say, all over the country got crumbs. We saw the $1,200 check. That's, you know, most places that's just a rent. Some places like San Francisco, Los Angeles, even in Orlando, where we are, you can't even pay rent for 1 month with $1,200. So what is your opinion on the bill? And if you were in Congress, what would you have done?
Yeah. Well, look, you're absolutely right, Rob. It's not enough. I want to be clear about this. Empowering people in this moment where the economy is free falling underneath them is a critical step to taking on this pandemic from a public health perspective. Why? Because right now people are making decisions between going out and saving their livelihoods or staying in and saving their lives. And they shouldn't have to make that terrible decision. So you're right. We needed healthcare coverage for every single person who lost their job. And that shouldn't be COBRA. That should be enrollment on Medicare. And if not that, then on Medicaid. We needed $2,000 for every individual throughout this crisis. We needed money to go to supporting small businesses and state and local government rather than to bailing out major corporations. And we needed a big bet investment in contact tracing and testing. And, you know, we haven't gotten those things in reality, and it's left us very far behind. And so, you know, the administration's handling of this thing has just been an utter failure, real chaos. But I will say that, you know, Congress's response hasn't been what it needed to be either.
For you, you're a medical doctor. What is your opinion on the virus?
Yeah, I mean, look, we're dealing with a really scary virus. It's extremely infectious and deadly, and we have to do what we can to protect ourselves. I think, you know, what we have to understand is that every day the information we get about the virus is 2 to 3 weeks old, and so we're constantly playing from behind. And so we've got to be really proactive about doing what we can to protect ourselves and our society. And one of the things that this has shown us is that we are all as vulnerable as the most vulnerable in our society. And we are all as exposed as the most exposed in our society. And so my hope is that learning from this, we are willing to get past some of this, you know, political polarization that is telling us that there are two legitimate sides to this story. But really, at the end of the day, there is, you know, the scientifically based side, and then there's everything else. Do what we need to do right now. And then as a society decide that we're going to build out the public health infrastructure we need to protect us from this ever happening again, and make sure that nobody is as vulnerable as they were this time. I think it's become a bit of a Rorschach test for our society. And I hope that it is uncovering some of the devastation that we see. I hear a lot of people say, you know, we got to go back to normal. And I'll just say that normal wasn't so normal for a lot of people who went without healthcare, who had to work gigs that they'd lose rather than real jobs that provide benefits, for immigrants who have to live in the shadows. You know, it hasn't been so normal for them. And so my hope is that we build a society where normal really is normal, and that people are secure in the lives that they lead because we learned our lesson.
Well, this leads right into the next question. You ran for governor in 2018. I'm sure you've thought about this. If you were the governor right now, we saw the protests in Michigan and all over around the country, but they're running around in the state capitol in Lansing with guns, and it's insane. They're doing it in California too. And, you know, as you said, this is not a political issue. This is about the health of Americans, and we should not be running this like it's a re-election campaign for Donald Trump, and so we can open up the economy, make sure people make money. It should be the health, and that we have 90,000 plus people dead. So if you were governor, what would you do as far as opening the economy up?
Well, look, I think the key here is, you're right, to put public health ahead of the politics. To me, you can't really open up, quote unquote, until a couple of key things are met. Number one, that you've seen a steady decline in the number of cases over, you know, I think a 3-week period. Two, that your health system is robust and ready if another outbreak happens, another wave of real infections happen. Three, that you have the contact tracing and testing capacity to go from mass social distancing to what I like to call precision social distancing. And four, that the economy can be opened up, is ready to open up safely. And so that's a scientifically based, evidence-oriented approach to doing that. It's not just something that you hold up some leaves and ask which way the wind's blowing and decide you're going to open up. And the frustration is that we haven't really applied our best science to this, and a lot of people have been pushing in pretty aggressive and frankly violent ways to do that before we're ready, and it's going to cost lives. So if I were governor, right, a couple of things I would be establishing and being very clear about what those guidelines are, and being very transparent about my choices. And number two, I know what it's like not to have the right to protest. So as a general rule, I always go and talk to protesters, even if they're protesting me. When I was the health director, we got protested on animal control stuff early on. The last animal control director had really failed on a number of fronts, and so people were protesting. And so I went out and talked to the protesters every day, and I think that's really critical. I would do the same here. I know that's dangerous and sounds crazy, but as a governor, you have a security detail, and but there's a space when you even sit with someone and say, like, look, I'm here to talk to you. You're protesting. I'm listening. Tell me what's wrong, and let's have a conversation about it.
Right. I want to move into the last few questions on this. You did write the book, Healing Politics. Can you tell the viewers a little synopsis about why you did that and what it's about?
Yeah. So I trained as an epidemiologist, Rob, and in my experience, I had thought that when I ran for office, that the epidemiologist in me would have to sort of take a seat. And as I was campaigning, meeting people all over their homes and VFW halls and in far reaches of the state of Michigan, I came to appreciate that that the epidemiologist in me was still actively working, trying to answer a question. Epidemiologists always ask, why are we sick? So why was our politics sick? And this book is an answer to that question. I diagnosed an epidemic of insecurity, that the failures of interlocking systems in our lives have left us fundamentally insecure about our future. And there's no indication of that insecurity that's more clear than this pandemic. And I talk a little bit about how I think our politics needs to reframe around taking that on.
Yeah, I want to talk about this. You also have a podcast out, and can you also speak to the viewers about that if they want to find more about you as the podcast too?
Sure. It's nowhere as good as Rob's, but it's called American Dissected, and what we do is we dig into to big public health questions. This entire season's been focused on COVID-19. We've interviewed Andrew Yang and Bernie Sanders, as well as a number of experts and technical leaders about this virus, and folks can check it out, American Dissected, wherever you get your podcasts.
Who do you see as the next leaders of the progressive movement? And also, what do you think the movement needs to keep that motivation?
Yeah, well, I think the folks you named are great. And you're right, movements do require leaders, but I think there's a whole generation of leaders on their way, and maybe people whose names we've heard and people whose names we haven't. But people are out there thinking a lot about where we head. But one of the interesting things about our movement is it doesn't require figureheads as much as it requires you and I to get out there and do the work. And so, the leaders that I'm more concerned with aren't the people whose names everybody hears. The leaders I'm concerned with are the folks who, are their neighborhood block club captains, who are, leading their local union chapters, who are organizing on campus, and who are doing the work of having hard conversations with people about who we are and who we want to be. Those are the folks that I look to for leadership. And I think our movement is really bright because of them.
I want to end with this and tell the viewers this is a man that we should, definitely get elected to office. I hope you run for something again. Can you just recap with the viewers where they can buy your book? I know you just said another book on Medicare for All is coming out, and also where they can find more about you.
Yeah, absolutely. Well, it's kind of you to say, Rob. So folks can go to my website, abdulelsayed.com, or for Healing Politics, go to healingpoliticsbook.com. or for the Medicare for All book, medicareforallbook.com. And so I hope folks will check them out, and make sure to follow us on American Dissected and social media. I try and keep it active on Twitter and Instagram. So always good, Rob. I appreciate you having me here today, and thank you for your work and your show, and look forward to connecting hopefully when we're both in Michigan.
Yeah, thanks so much. Abdul El-Sayed on Fire Breathing Rob.